A pilot program involving 50 chronically ill patients in the Newcastle region showing remote monitoring tools can rapidly improve quality of care, particularly in regional areas. Hunter Nursing rolling out the initiative with the Intel Health Guide. It's a device sitting on the patient's home, sitting in that home at least, to monitor vitals like blood pressure, blood oxygen and plenty more. The Business Channel's Helen Frost speaking to the company's Director of Nursing, Margaret Scott, and started by asking about the problems and that the solution can address.
Hospitalisation rates of those living with a chronic disease in the community. We wanted to measure whether there was a reduction or a change in their hospitalisation rate. We wanted to look at whether the number of visits to an emergency room or the number of emergency calls to an after-hours GP practice were reduced or changed with the introduction of remote patient monitoring. So they were the issues that were first and foremost in our mind, and those issues all reflected financial outcomes as well.
A lot of your patients are in aged care. How keen have they been to adapt to this technology?
One of the things we felt was we were a little bit concerned about how the aged, particularly because a lot of the cohort that we will be studying were in the aged area. You know, there was 76 plus. And so we wondered, are they going to be able to manage the technology? But we decided that with good education and good contact and interaction with the nurse clinician and the patient in the home, we felt that we could overcome that potential problem. Well, what we've actually found is that the patients are responding very well. I mean, it's such a user-friendly device. It's something that the patients are not threatened by. It's something that they can use very easily. They can read it very easily. You know, there's large printing, it's quite touch sensitive. It offers them a wealth of information at the touch of a button. So they're receiving information about how they can participate in their own health management straight away. So all of a sudden, any fears that they had are dissolved.
So give us an example of one of your patients that's actually using this technology and how the process goes.
For example, we may have an elderly woman living at home. She's in her 80s and she is living with a chronic disease. She has, on average, maybe 3 to 4 hospital admissions a year, which is very unsettling for her, and so the future is uncertain. With the remote patient monitoring guide, this service, what we're able to do is arrange that every day at 10 o'clock this lady attaches her blood pressure cuff and measures her blood pressure. She attaches her pulse oximetry peripheral, we call it, and her pulse is measured. She stands on a set of scales and her weight is measured. They're vital recordings that are sent to a nurse at the monitoring centre. The nurse can look at those recordings and determine, are they within normal limits or are they outside of the normal parameters that the general practitioner or the medical clinician has identified as being normal. If they're normal, the patient knows, if the nurse doesn't contact them, that everything's fine, I'm well, my readings are normal, I go on with my day. If one of those readings was outside of the normal parameters, the clinician may choose to have a video conference call with the patient, and that is where we just have this value added capacity with the Intel Health Guide, in that we can video conference straight away with the patient.
And what about the nurses? How is it changing the way that they work?
The nurses, their morale has lifted. You know, they have acquired a new skill set. They've got opportunities for working in alternate workplace environments. They're feeling satisfied because they're having direct interaction with their patient and they're able to provide advice or initiate a further response for the patient. They're also being able to manage their time more effectively, given that nurses are quite scarce today. If you send 10 nurses out to see 10 patients and they all travel 100 kilometres, you're really losing a lot of valuable nurses' time when they're sitting in cars in traffic or travelling large distances. They get to the patient's home, it might take them half an hour to get there, they monitor the patient's blood pressure, have a chat, then they drive half an hour back to the office or to another patient, and they do that 10 times. Now the nurses we're finding are able to interact with maybe 50 patients in a day.
Is the take-up of e-health services gathering momentum, or is it more just about interest at the moment? How's the funding going?
I think our industry is very interested and committed and to the notion that this is something that we need to be very serious about in our delivery of healthcare. However, there are significant gaps in the funding sources, and I guess on the ground we're all committed and we've got data now to support the resource effectiveness of remote patient monitoring. We're just waiting for someone to take that giant leap of faith and commit to it and provide some funding streams.
Brief read on the SPY 200. It's reset and it's actually ticked a little higher, so implying some greater strength than we had been expecting there when we come online in just a couple more minutes' time. 0.4% clear, 20-odd points. In the last hour, BHP Billiton, of course, saying it's moving most iron ore sales to shorter contracts, and that really dovetails with news reported yesterday by Japan's Nikkei to do with Brazilian mining giant Vale approving a tentative quarterly iron ore price deal with Asian steel companies to boost those prices by up to 90%, and that's really another sign that the rigid benchmark system is under pressure. There's a shift into the derivative-driven system, similar very much so to other commodities globally like oil. We are seeing that seismic shift occurring. One to watch with interest, Vale potentially leading the charge in that direction with its negotiations now with the Chinese. Okay, we will take a short break. As mentioned, we're just around the corner with a new trading day and Brooke Corty in the chair for the first hour. Stay tuned.